Hello everybody. I would like to take the opportunity and educate you about Invisalign versus conventional braces. It is extremely important and I am going to tell you exactly what I would do for my own family. When you go to a dentist, if the dentist is a general dentist, a lot of these general dentists are pushing Invisalign because they simply look into their toolbox. Doing conventional braces is not easy. Conventional braces, it takes years of experience. It takes years of specialty work. That expertise is necessary to get the teeth in the right position. Invisalign or clear aligners, they are kind of a shortcut that people take, and there are so many disadvantages to that. I would like to start with something very simple. America is the country of cars, and people understand cars. When you go and get new tires, you need alignment of those tires. You do not align the back tires separately from the front tires, or the right tire separate from the left tires. All of the four tires are aligned together. Same goes for Invisalign. Invisalign or clear aligners, what they do is they straighten your upper arch, and the trays, the series of trays that they use, they straighten the lower arch. So you have a straight upper arch and you have a straight lower arch, but the occlusion, the word occlusion, it means the way our teeth come together. The teeth do not come together in harmony. In many cases, they actually harm your TMJ, your temporomandibular joint. So it's exactly like I said, like a car. You align your back tires separately and you align your front tires separately. So you're driving, your front tires are going this direction and your back tires are going the other direction. How bad is that for the tire? Guess what, folks? In the mouth, you don't have the luxury of getting new sets of teeth. We only get two sets of teeth. One is our baby teeth and one is the adult set of teeth. So we have to be very careful of protecting these teeth the right way. Unfortunately, we are in a society that everybody is looking for a quick solution. Nobody wants to work to get things done properly. And I do understand there are disadvantages to braces as well, and I'm going to discuss with you. But first, I want to tell you all the disadvantages of clear aligners, that they actually compound the problem for the patients. I feel guilty every time there's a patient that comes to me and says, "Doc, I don't want braces, I don't want any metal showing, I just want to wear these trays and get my teeth straightened." I feel guilty that I would tell them, "Oh sure, here you go." And don't get me wrong, it does bring income for the office, but you have to always treat the patients like they are your own family members.
Ohana means family.
My own daughters, one of them has already just finished her braces, and the other one, the little one, is about to start. If it was good, trust me, I would do it for my own family. By the way, clear aligners are meant for very, very minor orthodontic adjustments. Like for instance, you have a tooth right in the front and the tooth is, kind of buck tooth is a little bit out, and you want to push that tooth back in place. There is an indication for that.
All better. That should seal up that drafty gap.
But for a complete set of orthodontics, please do not do that. As a good conscientious dentist, when they would look in a patient's mouth, if they see something that they cannot do it themselves, they would refer it to the specialist who would do that. And there are too many general dentists who are guilty of not doing that. They look in the patient's mouth, they see some teeth are not in the right position, and they tell the patient, "Would you like to have an instant orthodontics?" What is an instant orthodontics? They shave perfectly good teeth with good anatomy, but they're not in the right position, and they cap or crown a whole bunch of front teeth. And yes, it looks great because overnight basically, or over a period of 2 weeks, a person can have a perfect looking smile. But at what expense? Basically, a perfectly good tooth has been shaved down, enamel is shaved down, and is replaced by porcelain and man-made material. So it is best to preserve your teeth. If your teeth, they have good color, they have good shape, get braces and put them in the right position. So what I like to talk to you about is, I would like to tell you that whenever you do Invisalign, basically, when the Invisalign or clear aligners, they grab the crowns of the teeth, the upper part, this part of the teeth which is sticking out of the gum. All they do is they move that crown They move the coronal part of the tooth. They do not do anything for the root of translating or doing anything to the tooth, the root of the tooth. So what happens is that it's like you have this tooth that you are pushing it, tilting it to a position that you would like to make it look straight, but because the root is not moved, this crown is kind of bent, and then when you let it go, what happens? It goes right back to its original position. Vast majority of Invisalign cases, they all go back to the original position of what the tooth was before. So in a way, it's a waste of money and a waste of time. Now let's talk about braces. You know, as you see right here, these are conventional braces right there. They have these brackets, and when you smile, of course, you see some metal. There are some clear brackets. If you use clear brackets, when you smile, you actually don't see these brackets. So ask your orthodontist, ask the person who's actually doing braces for you for the option of clear brackets. It's a very good compromise. When you smile, you barely see there is a wire going across, but you do not see those metal brackets. When you put a bracket on a tooth, you basically have, here's a tooth right here, and can you imagine here's a bracket on this tooth right here, and this bracket is glued to that tooth. How many moves you can do with this bracket? Infinite. Honestly, infinite amount of moves you can do when you have a bracket that is on top of this tooth. And you can move it side to side, you can erupt the tooth, you can push the tooth in the socket, you can do infinite amount of moves with when there's a bracket on the tooth, just like that. But when you have a cap on this tooth, basically like the Invisalign or the clear aligners, it grabs the crown of the tooth, and these are the movements that it can do to the tooth. Basically these movements, in some instances even erupting the tooth, but it will not be able to grab the whole tooth and move the whole tooth from one position to another position. You have to really think about, what are you looking for? Are you looking for just cosmetics and nothing else matters to you? If that's the case, then clear aligners may be the right thing for you. There are some cases, for instance, there are actors, actresses, there are people who are in the middle of a movie and they absolutely have no choice. If you absolutely have no choice and it helps your career, that's really the only indication I can think of. But any other person, an individual, as a patient, I strongly recommend you go with conventional braces and ask your orthodontist about clear brackets, and that's an amazing compromise that you can make and you will get good results. When you do conventional braces, not only the orthodontist aligns all of your teeth nicely and they're all straight and beautiful, like a nice, beautiful aesthetic smile, but also the lower ones and the upper ones are aligned against each other. And if you take a little mustard seed and it's under your teeth, it drives you nuts. You put something so tiny. It's like you go to a dentist, they do a filling on your teeth, and if the filling is just slightly high, it drives you nuts. It gives you headache. Why is that? It's because the upper teeth are not coming together against the lower teeth. And when that doesn't happen, and that malocclusion or bad occlusion, bad bite, when that happens, it creates pressure on the joint right here, and it will create problems for you. Can you imagine, instead of one mustard seed or one tiny amount of high spot, you have a whole bunch of teeth that are up and down, and they're not coming together right. But when you smile, it looks straight. It's not worth it. So my recommendation is, if you're not gonna do conventional braces, you might as well not do anything. Best wishes to you on your decision, and make sure, whatever you do, do your studies, do your research, learn about it before you make a decision. So, who is the most important person in your life? It's you. So make sure you treat yourself well and make sure you do the right thing for yourself.